Hey everyone, so this video is going to be for a diastasis recti assessment. So you're going to perform this assessment on your back with your knees bent, okay? And before we even dive in, the first thing I want you to do when you go ahead and lie down is you're going to be performing a crunch, okay? So lifting your head and neck and shoulders up off of the floor. And I want you to notice in your abdomen any coning or doming, sometimes referred to as bread loafing. Now, there's a slight difference between coning and doming, but for purposes of this video, we're just gonna use those terms interchangeably. Again, if you look this up, there's gonna be a difference, but we're just gonna keep it simple while we're here, okay? If you perform that crunch and you notice that, again, it's called sometimes bread loafing because it can look like just a loaf of bread sitting on top of your abdomen, that is a pressure management issue that we want to address in programming, okay? So that's the first thing I want you to notice when you go ahead and do your crunch, all right? The second thing we're gonna assess is the width of the gap. So you can imagine that nice like six-pack muscle on your abdomen, right? A diastasis is when that line down the middle of those two muscles is separated. So we wanna notice if there is a gap in between those two muscles. So we're gonna assess the width of the gap. It may be different from above the belly button and below the belly button. So we wanna notice again if that gap is different in those different positions, okay? The third thing we're gonna assess is the depth of the gap. So we're gonna assess the width first. I'm gonna show you how to do that in a minute here. And then we're gonna be poking in and noticing how deep that gap goes, okay? Again, that might vary throughout the diastasis, but that's what we wanna know. And then the fourth thing we're gonna assess is the tissue integrity. So if we push in on that gap and it feels springy and firm, we wanna note that. If we push in on that gap and it feels squishy and soft, that's another thing we wanna note, okay? So we're really gonna be looking at four things when we do this assessment. Number one is that coning, doming, or bread loafing when you lift your head and shoulders up. Number two is the width of the gap. Number three is the depth of the gap, and number four is the tissue integrity, okay? So let's go ahead and lie down. We're gonna be lying on our backs. You're gonna wanna go down on your side and roll onto your back, knees bent, and you're gonna start off by performing that crunch. So when you perform that crunch, again, notice you have that coning, doming, or bread loafing. That's the first thing you wanna note. Then, once you note that, you wanna take your fingers and point down towards your pelvis, and you want to start up at the rib cage and just notice if there is a gap between the muscles in your abdomen. How wide is it? Is it 1 finger wide, 2 fingers wide, 3 fingers wide, or more? Okay, you want to note that width here and just feel all the way down to the belly button. You might notice that at the belly button it increases. That's okay, that's normal. Again, you want to note by how much. So if you have a 1 finger gap here and then a 2 finger gap here, just make note of that. And then walk a little bit below the belly button until you're right around those hip bones, okay? That's about as far down as we want to go. Again, noting the width of the gap. How many fingers wide is your gap throughout that midline, okay? Take a rest of your head and shoulders if you need it. And then the third thing we're gonna assess is the depth of the gap. So you're gonna take your finger and you're gonna poke it down into that gap. So go ahead and lift your head and shoulders again if you took your break. And you're gonna go ahead and just push your fingers down into that gap, okay? And is it going down halfway to your fingernail? Is it all the way to that first joint? Or deeper, right? And you wanna just poke down and see how far down does that gap go, okay? And again, it might change throughout your midline here, and that's okay. As you get deeper, the gap might get a little deeper, and that's okay. Okay, so note how far deep in your finger did that gap go, okay? Now we're gonna feel again, and we're gonna assess that tissue integrity. So go ahead and do your crunch, push down. Does it feel bouncy and firm and springy? Does it feel soft and squishy? Assess the integrity of that tissue here. When you're done, you're gonna roll onto your side and push up. And for the diastasis assessment, you can go ahead and answer the questions in the instructions here to make sure that you hit all of your points, and we can go ahead and get your assessment completed.